Just a quick note about the concurrent chemoradiation or the role of concurrent chemoradiation in patients above the age of 70. Because I think in the last lecture I added it in the post-operative setting, but I think this was not correct and accurate. So let me explain it in more detail just to clarify it for the sake of science rather than the exam. For the exam, you don't use the concurrent chemoradiation for patients above the age of 70. And this is based on the meta-analysis. When we talked about, I just brought the slide that we talked about it here so that you just can refer it to it back. So the famous meta-analysis for concurrent chemoradiation that showed the benefit from concurrent chemoradiation in patients above the age of 70 is lacking. This is a meta-analysis was talking about the radical concurrent chemoradiation versus radiotherapy alone. So the benefit of adding chemotherapy to patients above 70 is not present in the meta-analysis for the use of chemotherapy in this huge meta-analysis for randomized trials. But the question would come if you are asking about in the post-operative setting, because I talked about it in the lecture with the in the post-operative setting, but I think it was better to be discussed, or was supposed to be discussed with the concurrent chemo radiation part when we talked about the laryngeal preservation part of or the laryngeal preservation lecture. But it came by default because in the exam usually we don't use chemo-rad for patients above 70. But there is a very important point you have to be aware of, just for the purpose of science, not for the exam, this one, that the benefit of concurrent chemoradiation in the post-operative setting for patients above the age of 70, I think, is lacking. We don't have it. So there was a meta-analysis for the same group, subgroup meta-analysis for the same group. They looked at around 5,000 patients in the post-operative setting, and they were trying to address the benefit of concurrent chemo rad versus neoadjuvant followed by surgery in the setting of 5,000 patients. So the post-operative setting as a separate meta-analysis or a subgroup meta-analysis. So this is very important. The same group did a subgroup meta-analysis for 5,000 patients in the post-operative setting, trying to see if there is a benefit of adding concurrent chemo rad to the patients in the post-operative setting. And the meta-analysis was positive for that purpose. So it is positive that concurrent chemo-rad improve disease-free survival and improve overall survival for head and neck cancer treated by concurrent chemo-rad versus radiotherapy alone. But when they looked at the patients with 70 plus, there were like very few patients. So there's like out of 5,000, there was something like 300 something patients. So they couldn't stratify the patients above 70 on their own to get a conclusion that the patients above 70 will not benefit from the concurrent chemoradiation in the post-operative setting. So this is a very important point. I wanted to make it very, very clear. When I was talking about the 70, we have the strong evidence coming from the meta-analysis for concurrent chemoradiation, but it is mostly a radical approach. If you talk about in the post-operative setting, there is no evidence that the concurrent chemoradiation for patients above 70 may not be beneficial. By contrast, there may be a benefit if you talk about a subgroup analysis of 300 something patients in the meta-analysis done by the same group for concurrent chemorad in the post-operative setting. So this is a very important point. It could be that the number is too small to show us a difference or lack of benefit. It could be. And it could be also that patients with 70 plus going for surgery is fit enough to tolerate concurrent chemoradiation. And this will put another question mark, as we talked about it before. Is it the age cutoff 70, or is it the biological age? Is it the 20, 30 years old clinical trials using very old techniques with this meta-analysis radiotherapy versus concurrent chemo radiation that added to the toxicity, added to the lack of tolerance for the concurrent chemoradiation patients? So there is a big question mark for patients above 70. 70 is just a figure. But patient with 69, for example, what's the difference between a patient with 69 or 70? I don't know. In the post-operative setting meta-analysis, they added the patients above 70 to the patients below 70, and they took a cut-off age of 65, and they still couldn't find, and still they found a benefit for this group of patients in the concurrent chemorad setting. So it's very difficult to conclude that concurrent chemoradiation may not benefit patients above 70 if they went for surgery and they need the concurrent chemoradiation. So you may think about it, but not in the exam. Not in the exam. It's very important because it's a kind of very well-known standard that above 70 toxicity is more and the patients may not tolerate the concurrent chemorad, and it will be wise to not to give it. And I just wanted to give this note, and even in English, because it's a kind of very confusing part of the lecture. So I just wanted to make it very, very clear. And thank you.